Hello everyone, I'm Zihan. Welcome to my outreach project for Psychiatry 135. Before I start my talk, I would like to ask you the following questions. Do you believe that you can catch up on sleep debt without consequences? Do you believe that snoring is normal and harmless? Do you believe that alcohol helps you sleep better? Do you believe that you fall asleep in class because you're bored? Do you believe that it's okay to hit the snooze button over and over again? Before I take the class, I actually believed in these. But now I understand that these are all just common misconceptions about sleep. In this 5 minutes talk, we will briefly discuss some basic facts about sleep, and hopefully these facts will help you understand your sleep better. Let's start with the basics of sleep cycle and rhythm. First, there is circadian rhythm, an internal clock of our body that lies in the suprachiasmatic nucleus. It affects sleep hormone secretion, temperature regulation, cognitive function, metabolism, and muscle performance. Pretty much everything. It's a near 24-hour rhythm. It persists in constant conditions and can be synchronized to 24-hour cycle. There are two process modes of sleep. The first one is circadian, which synchronizes our sleep-wake cycle with the external environment. And the second one is homeostatic, which regulates the body's need for sleep. There are four stages of sleep. The first and the lightest stage of sleep is the non-rapid eye movement stage, followed by still the non-rapid eye movement stage, where heart rate and body temperature drop. The third and deepest stage of sleep is characterized by signals with lower frequency and higher amplitude known as delta waves. Finally, the fourth stage is the rapid eye movement stage, where dreaming and rapid movements of eyes occur. There are several factors that affect our sleep quality. High levels of stress and anxiety can make it difficult to relax and fall asleep. Stress hormones can interfere with body's ability to enter a relaxed state that's conducive to sleep. Consuming caffeine, nicotine, and other stimulants close to bedtime can interfere with sleep quality too. While alcohol may initially make you feel drowsy, it can disrupt the quality of sleep by interfering with the rapid eye movement stage of sleep and causing fragmented sleep patterns. Light can also affect your sleep as it interferes with our circadian rhythm. Finally, misaligned circadian rhythm, for example, caused by jet lag, can also affect our sleep. Next, let's look at some common sleeping disorders. First, let's look at insomnia. It's characterized by difficulty falling asleep or staying asleep, waking up too early, and not being able to fall back asleep again, and daytime fatigue, um, irritability, and difficulty concentrating. It can be helped by cognitive behavioral therapy, which includes getting rid of negative association between bed and poor sleep, restricting time in bed, and eliminating anxiety associated with insomnia. Another common sleep disorder is sleep apnea. It is characterized by loud and chronic snoring, pauses in breathing during sleep, gasping or choking sounds during sleep, and excessive daytime sleepiness. It can be helped with a CPAP machine. So if you're experiencing any of these symptoms, go see a doctor. Another sleep disorder is narcolepsy. It's characterized by excessive daytime sleepiness, sudden loss of muscle tone, hallucinations, and sleep paralysis. If you're experiencing any of the symptoms, seek medical help immediately. Next, let's talk about sleep debt. It is the cumulative effect of not getting enough sleep. That is, the amount of sleep that we should get minus the amount of sleep we actually get. The consequences of sleep debt include drowsiness, mental or physical fatigue, and adverse effects on one's mood, energy, and ability to think clearly. Finally, I would like to emphasize the most important thing I learned from the class, which is the class motto. Drowsiness is red alert. More than 300,000 drowsy driving crashes occur annually, and it's one of the major causes of death among young people. So remember, drowsiness is red alert. Stay safe, sleep well. If you have any questions, please comment